Hey, if you're here, you're either a victim of anorexia nervosa or bulimia nervosa. Those are eating disorders and that is covered in mental health. Um, Maybe you're not a victim or you were just someone that is genuinely curious. You want to know what these big terminologies mean. Or, someone that is suffering from that. Probably your relative or maybe your friend or a friend of a friend, whichever the case that has brought you to this video right now. I promise that you're in the right place. We're going to be talking about this for a while, and I hope you learn something from it. If you're here because maybe in your resolutions for the new year you want to get past this eating disorder that you have, then this is the right place to be. We are going to be talking about all that and things that probably you don't talk about with other people. And hopefully you will feel better. And I can only hope that this year is the year that you get past that eating disorder. My name is Pam and I'm a registered nurse. I work in Kenya. And no, I do not work in psychiatry, but I have a few things that we can talk about in this particular unit. Even if you are not struggling with that, I really hope that you have a good start of the year and that this year 2023 is going to be the year that you get to achieve most of the things that you have wanted to achieve your whole life. Please, if you're new to this channel, remember to subscribe. That really helps me a lot. And kindly like this video. That will really mean a lot to me. So let's get started, shall we? So we are going to start with anorexia nervosa and then we're going to get into bulimia nervosa. So anorexia nervosa is an eating disorder that is characterized by food restriction, weight loss, and compulsive exercises. Now there are causes for this, and we are going to talk about the causes in classification. So the first classification is environmental/social causes, and then we are going to be talking about the psychological causes, and then we go to the genetics. So in environmental/social causes, the first thing we're going to be talking about is physical abuse. If you have been abused or you're an abuser to someone physically, know that you could be subjecting this person to anorexia nervosa. It doesn't matter whether you're a parent or you're just a person. Physical abuse increases the chances of someone suffering from anorexia nervosa, and so does emotional abuse. Anything that you do that affects someone emotionally could be a trigger to anorexia nervosa. Whether it's somebody that is going through a heartbreak or things that doesn't sit with someone emotionally predisposes them to getting this particular condition. So the other cause is teasing and bullying. So this something you need to get here. If you're a parent and you're watching this, please be mindful of your kids. Whether your kid is a bully or is a victim of being a bully, of being bullied on, bullying it, please know that they have a higher chance of developing anorexia nervosa later in their lives. If you're parents and you're going through a divorce and your kids are seeing this, they are also likely to get anorexia nervosa in their lifetime. There are other things there are other careers like modeling and ballet. I think I was reading an article somewhere and I saw that some models, I don't know how true this is, actually this is up for debate, and please don't hold a gun on me for saying this, that they do take cocaine to kind of suppress their appetite so that they don't get big. So that is a thing. So some things like modeling and ballet, those might cause you to get into anorexia nervosa. And I don't know how we can help our models. or aspiring people to be models. I just think maybe there are healthier ways to lose weight or to not be big other than using. That is a really hard drug. Cocaine is really a hard narcotic, right? So I don't know. The other things in environmental causes that can cause you to get anorexia nervosa, especially PTSD. This majorly after sexual assault. PTSD, we said in my mental health video. If you've not watched that video, I'll leave a link in bio so that you can watch it. We said it's what happens after you go through a traumatic disorder. So in this case, sexual assault is really major in anorexia nervosa. Please stop assaulting people. It doesn't matter nowadays. Women are assaulting men, men are assaulting women. It's not the way we knew traditionally that women were the victims of rape. So whether it's sexual, like there was penetration or there wasn't penetration, whatever you do that makes somebody feel sexually assaulted predisposes them to getting anorexia nervosa. So besides getting anorexia nervosa, if you sexually assault someone, remember healing might even take a lifetime. Sometimes these victims go and get married and they even have kids, but in their field, sometimes when they are alone, or even a moment just comes and they remember that. It's not really funny to do those things. I don't know why people do them. So there are so many. You predispose someone to PTSD, then there is anorexia nervosa, sometimes depression. These small things that we do, they are not funny. Okay, so don't sexually assault someone. It's not good. It will never be good, and it will never be justified to sexually assault someone. It takes a really long process to get these people back to recovery. So the other thing is loss of a loved one. If you've lost a loved one in the recent past, you're likely to suffer from anorexia nervosa. So let's get into the psychological causes of anorexia nervosa. The first one is anxiety disorders. So whether it's generalized anxiety disorder or it's social anxiety disorder or the other one, you're likely to get anorexia nervosa subsequently. And then if in your head you have made it, there is this perfect body, there is this ideal body that I must get, you're likely to have anorexia nervosa. As a parent, if you realize that your child is showing features of being autistic, they're also likely to develop anorexia nervosa in their lifetime. Also, there are cultural things, like I think there are communities that believe in smaller bodies. I don't know. I might be so wrong to say that. I think Asians fall in this. I don't know. I'm just saying. It's what I've seen in social media. Or, those beliefs, or if you have experienced history of dieting or other weight control methods, you're likely to develop anorexia nervosa. So let's get to genetics. The genetic causes of anorexia nervosa. And the first that we're going to talk about is if you're a type 1 diabetic patient, you're highly likely to develop anorexia nervosa. I have seen this personally. I have seen this with my patients. I don't know why. I'm actually looking for the answers up to this minute why they have that. You'll find that lunch was served and they still have not eaten. They don't want to eat. I don't know. They don't want the sugars to go high. There's usually this thing with the type 1 diabetic patients. And the other cause is, if there has been in your family, there has been even one member of your family that has suffered anorexia nervosa in the past, then you could suffer from that. Then in your family, if there has been a person that has been mentally unwell, then you're likely to suffer from anorexia nervosa. So how do you diagnose anorexia nervosa? Diagnosis: you might need a psychiatrist, a physician, a dietitian, and a medical doctor. Oh, and also a pediatrician is in here. And also now for treatment, you'll need a physician, a psychiatrist, a therapist, and a medical doctor. They will also be included here. And there goes for, when you come to the hospital, there are goals that you're working towards so that you recover from anorexia nervosa. And the first goal is to get you to a weight that is healthy for you. Then we need to treat or deal with any underlying mental health condition, and then we need to deal with any complications, especially sometimes malnutrition, electrolyte imbalances. We need to deal with those. Then the final thing we need to do is to make sure that we prevent recurrence of anorexia nervosa in the future. So treatment revolves around there's a pharmacological treatment, and there is the therapies, and definitely hospitalization. So in the pharmacological treatment, we mostly go with symptom management, but mostly an antidepressant is going to be used, and in this case we mostly do olanzapine because it helps. I think it boosts your appetite, so you're likely to eat and gain some weight, but mostly it's symptomatic. And then we have the therapies. We've talked about this in the other video of how to be mentally well. So the first therapy is usually cognitive behavior therapy. This is the major therapy that is used in eating disorders. So remember when you said that a behavior can be learned, so it can be unlearned. So we help you focus and see that there is this thing that you are doing that you got to learn, and we help you identify this behavior. And so we also help you shift how you think about this behavior, to help you change it. And then we have family therapy. Your family is going to be involved in this. There's interpersonal psychotherapy, and then there's acceptance and commitment therapy. And remember, you're likely to get hospitalized because sometimes this can be fatal, and it could complicate into very life-threatening conditions, such as having an electrolyte imbalance. So you might need hospitalization for us to correct that. Let's get into bulimia nervosa. I hope you've learned something about anorexia nervosa. So bulimia nervosa is characterized by excessive binging and then purging. So binging is eating a lot of food, and then purging is getting rid of this food in some way, in some sort of way, So there are these two types of bulimia nervosa. The first one is purging, and purging bulimia nervosa is you eat the food and then you get rid of it in some way. Like maybe you use a laxative, or you kind of induce vomiting, or you use diuretics. So you see, in these three ways, you're getting rid of the food. In purging, you eat the food, yes, and then you get rid of it through the next time you don't eat, like you starve or you fast, or you do compulsive exercise, like you work out a lot. Now, a while ago, there's been a lot that has been going on in media that, bulimia nervosa majorly occurs in white young people. I think Hispanic white young women. But I'm here to tell you that that is not the case. This is happening to everybody, despite of the age, despite of the race, despite of the gender, and sex. It is happening to everyone. Now, there are things that you can do or you can actually observe in a person that is having bulimia nervosa for you to say that maybe this person, I'm suspecting they're having bulimia nervosa. So you'll find food wrappers in very unexpected places, maybe in the toilet, because people that suffer from bulimia nervosa, they hide it. For real, they do hide it. They find it really embarrassing, so they hide. So the food wrappers are not going to be on the table. No, very rarely. That's so normal. And then after eating, if in your social gathering, or you just say two of you, you realize it. After eating, immediately they go to the toilet. And then the victims of this condition work out a lot. They could be sick, but you find them out running, or the weather is just not conducive at all, but they're working out. Or they are just excessively tired. They just came from work, they're reporting, oh, I'm so tired. But what they are doing is compulsive exercise, even after they stated that. The other thing is that they're constantly using mouthwash, they are constantly on mint, gums, those kind of things. You will find they are the characteristics of a person that is suffering from bulimia nervosa. So there are causes of bulimia nervosa. It's genetic. Sometimes it just runs in the family. Sometimes it's PTSD. Remember when we said that in anorexia nervosa, the most common cause of the PTSD is sexual assault. Now in bulimia nervosa is military. People that have worked in military are likely to suffer from bulimia nervosa. And the other thing is bullying. Yo, guys, you have to be really careful. I think bullying is really a thing. And I have learned one thing about this. It will never stop, and there's nothing you can do about it. Okay? So there's nothing you can do about making the bullies stop to bully you, but there's something that you can do about you that will make you immune to these bullies. All right? The first thing you have to do, please work on your mental health. Be mentally okay. Try to be mentally healthy so that you get immune to these bullies, because this might never end. We found people talking about it before you were born. We are born, we are old, and people are still talking about it, and the generations ahead of us are still talking about it. So this might never come to an end, but you have control over what you feel about these people. Practice lots of things, like practice meditation, journal things, make yourself mentally healthy so that you resist these things, because they are going to do it, and you can't allow yourself to suffer because of these people that are so selfish and just not careful with things that they say to you. You can't control what people tell you. You know that, right? So work on yourself so that whatever anybody tells you doesn't take a toll on you. The other cause of bulimia nervosa is emotional distress and underlying mental health conditions such as depression. So diagnosing this is not easy, and of course the team that can diagnose anorexia nervosa is highly capable. It's still the one actually that diagnoses bulimia nervosa, and it's not easy. So here a physical exam is really needed. and we might need to do an MSc on you. So we are going to give you mental health questionnaire so that you feel it, and the management now starts from there. And you know, as we've talked earlier, management of this is mostly therapy, because actually in bulimia nervosa they don't recommend use of pharmacological treatment. You might find them giving Prozac, that is fluoxetine. That is an antidepressant. It gets you in your highs. It's the happy drug, so that you're not so depressed and so you don't think about food so much. Because I think in bulimia nervosa, people that eat that food, they eat it as a way of preventing. It's like a diversion kind of a thing. I don't know. So we give you fluoxetine, but that is not really enough. You understand that, right? So you need therapy. Therapy, sometimes it's individual or group therapy. Cognitive behavior therapy. You remember when you talked about cognitive behavior therapy in anorexia nervosa? It's the same thing that is going to happen here. Then you need nutritional therapy. And you know, depending on how severe your symptoms are, you will need inpatient or outpatient rehabilitation. I hope you've learned something about this, you know, eating disorders, kind of a problem. If you are a victim of this, I can only wish you quick recovery in your healing process, because this is going to take time, and you're going to need to be extra patient with yourself, and you're going to remember that you are human. Sometimes it is good to have resolutions, and as good as that is, you have to remember that you can fail, because that only justifies you as a human being. Do not beat yourself up because you said, oh, by this month I will not be binging, I will not be purging, I will not be restricting myself to eat, and I'm still doing it. I just started. There could be relapses in mental health recovery journeys. So you have got to be patient with yourself. And if you're a person that is dealing with a victim of eating or any mental health disorder, you've got to be patient with these persons. And if you're the person that discovers that a person is suffering from an eating disorder, be very wise about how you go about it. The initial response matters a lot. If you know, whether they are going to be open with their doctors, whether they're going to be open with a therapist, that is going to matter a lot. It is going to be influenced by how you first respond, you know, to when you found them binging or something like that. Do not be the person who is going to be like, what is seriously wrong with you? How can you eat like this? This is not good for you. Why are you not eating? What is your problem? That is going to scare them away from getting actual help. So if you're the initial contact, please be really patient, be gentle. Because as I've told you, especially in bulimia nervosa, people do it in secret. So if you found them, it's like you've invaded their privacy. How you go about it matters a lot. And don't go telling now people there, even the family. Maybe you're the friend and you found somebody doing it, and then you go to tell the family. No, please be very wise about it, so that you can actually guide this person to recovery. Otherwise, I really hope you've learned something from this video. I love you so much, and I hope that this year becomes so fruitful for you, and I wish you really quick recovery, and I hope to see you in my next video. So goodbye guys. Ciao.